Hi, everybody. It's Dr. Kathy. How are you today? All right. So, yesterday I talked about erogenous zones, right? And it was the most delightful conversation that I've had in a long time. Why? There were so many areas that I learned about myself, and in particular, the Kspot, which I love. And there's just so much information that's coming in out of the, ordinary, which is unusual for me because I don't really get a chance to learn some of this stuff. So being able to get more information and dive into the new topic today, which is deep vaginal erogenous zones. I think it's so cool to compare the knowledge I had a long time ago to the knowledge that I have now, and I'm just enjoying learning. So I hope you can learn too and enjoy learning with me too, okay? So today we're talking about the deep vaginal erogenous zones that may play a role in the development of the female orgasm and ESR. First of all, let me tell you where I got this lovely diagram from. You can see this diagram. It is a diagram of half of the pelvis area of the, women, all right? So the woman has been divided into half. So you're seeing half of her inside, and the half of her inside is going to show you some important areas like the G-spot that sort of like will give you an idea of where they're located so that you know where to look or have your partner look whenever you're engaging in sexual activity, which is the game plan, right? Now, H. Summit, that's his name, okay? He's the guy that did this beautiful diagram, and he has a great article. If you need the article, let me know, I'll send it to you. He really has his zones or his spots. Remember, we have the G-spot, we have so many of them. And he's labeling them here, but there's some other ones that he doesn't label here. So I'll go into that, but I want you to understand that right now we're going to talk about the deep vaginal erogenous zones, which is like the G-spot. So comparing it to yesterday we talked about superficial touch, things that you touch on the skin, whether tools or your fingers, light pressure, deep pressure, and that is something that will elicit a sexual response, right? An arousal. This now is similar, right? But we're going pressure deeper. Remember I said, remember that? We're going deeper into the more firm pressure, and it's going to, again, elicit a response, especially during sexual activity, but it's going to be more unique and a little bit more intense compared to the superficial erogenous zones of yesterday that we talked about. So go back and look and listen to my talk from yesterday. This is more deep and it's harder to access, right? So the skin is easier to access. This is deep within the vaginal erogenous zones. I'm going to call it DVZ, okay? That's the abbreviation DVZ. With this diagram, you're going to see, again, some of the spots. And I'm going to try and describe it for you. I'm not going to describe how to stimulate it. That's another talk because it's a lot of information. But I want to, first of all, make sure you understand a few things. ESR, a new term for me, expanded sexual response, okay? Now, what is an expanded sexual response? An expanded sexual response is the orgasm that is so intense that you actually can become semi-unconscious. People have said, and I've learned this before from patients, that they pass out. And some just go almost passing out, right? Pre-sync could be almost going out. And there are women that experience that. They are called ESR. They have expanded sexual responses, okay? Now, I do not experience that. Do I wish I did? I'm not sure about that because it can be a little bit scary, but at the same time, I'm always curious about stuff like that. So my answer would be yes. I would love to understand what that is. And what I have read is that, again, if you need information, the literature, I'll send it to you. You can develop it. You can actually learn to become ESR, which is the more intense, the more physical and multi-orgasmic orgasm you can imagine. So it either can be long, very long, compared to the classic orgasm that we're used to. So we all know about the regular orgasm where you slowly peak, and then you come down, right? You plateau, come up, and then come down, right? You have your resolution phase, the different stages. This one is prolonged, and it can be prolonged along any of the phases. So the orgasm lasts longer, is more intense, and according to the research, they're saying it's because a lot or more than one of these hot spots, let me call them sexual spots or hot spots, including the G spot, they're actually activated, and they actually get to the brain all at once. So many pathways, right? We talked about the pathways yesterday. These have the same pathways that each person has independently on their own. And you'll find that you are having multiple orgasms, and it's firing off in the brain, and there you are, not realizing that you are lucky to experience expanded sexual responses. Okay? You are lucky. I just want my patients to get the regular climax, the regular orgasm, right? We're talking about expanded. So I just wanted to mention that so that you know something newish, that there is something called ESR. And I want you to just, if you're interested, let's talk later on, but just know about it and know that, you know, I'm focusing on the simple classic one, but if you're interested in getting into the more advanced ESR, there are things that we can do to do that. So let me know if you're interested. And we might talk about it on another day, okay? You might not, I know Instagram, you guys can't read these words. I know it's mirrored, but the most important thing is the diagram. So I'm going to go through some of the spots. We know the G spot. The G spot is right here. Okay, now what I'm looking at, or what you're looking at here, I don't know whether you can see this, is the area inside the vagina, about 2 inches inside the vagina anteriorly, okay? So the anterior part of the vagina, which is the front part of the vagina. So if you're laying on your back, it's the front part when you bring your fingers upwards, okay? So if you bring your fingers upwards about 1 inch or 2, and I'm saying you or your partner, either one, you can actually reach the G spot. And that G spot is the size of a coin, right? And it changes as you are having your sexual activity, and it really gets soft and stimulated. And again, depending on each person, that can be a trigger point for you to have your orgasm. And I'm going to branch off and say that the orgasm is the ultimate game plan here. Why? Because you have 2 orgasms a week. 2 orgasms a week, you live longer. People don't know that. It is health. Having sex is a very healthy, great exercise, but a healthy stimulation of your circulation, opening up the brain, opening up the body, and having a good detox, right? And a good experience where your body rejuvenates. So it's very important to have sex and have that orgasm. So if you're not having an orgasm, talk to me. We've got to get that going, okay? And there's so many reasons why that could happen, but this is one of the reasons that it might not be happening, because we're not stimulating these spots, right? Okay. So the G spot is the one that everyone knows, okay? I don't want to go into too much detail, but another spot is called the clitoris. And that's what I have in my hand. Now, what do I call this spot? This is the bulb. Can you see that? Not sure if you can see that. Well, I should just come forward. That's the bulb, right? And that's what we see on the outside of the vulva, the vagina. We see that outside, but then it comes around the clitoris. Remember, this is the whole complex clitoris that we didn't know before. We thought it was a button. Now we know it is this beautiful structure that has the legs, the bulbs, the sides, and then all of this gets swollen during sexual arousal. And if you don't get swollen, you're missing out, because that swelling is what actually grabs the vagina, which is in the middle here. And so you get that extended orgasm because all of this is stimulated, not just the clitoral head. So we have to make sure that we get the whole thing stimulated. I just wanted to make sure I drew or had that, you know, for you to see, because I don't want you to forget. It's not a little button. It is big. Our clitoris is huge, and it really needs to be stimulated for you to get that orgasm, okay? It needs to swell up. So that's the clitoris right here, and I want you to see that it really is encapsulating the vagina right here. So the vagina is coming right here, and that is the clitoris, which he calls one of the hot spots. The G spot is the next one here, like I said, right here. Then we want them to be stimulated, right, during sexual arousal. Again, the whole part of the clitoris comes around here, okay? Again, this is half of the picture. This is the part of the clitoris back here too. So it actually comes to the anus. So remember, it's very big and it really needs to be stimulated. Then we have the U spot, right? This is in between the clitoris and where you urinate from, the urethra, okay? That is a U spot that people sometimes don't know about. Again, it's in that vulva area, that area where some people don't spend much time and some people do. So I'm encouraging you to find and locate your U spot in between the clitoral, the hood, the top of the clitoris, and the vagina. There's that little sweet spot there. And again, we all don't have the same spots, right? Some of us have some that are more intense and some that are less intense or bigger in size and smaller in size. Again, the ESR folks have a lot of them and they're very hypersexual. And you probably could spot them a mile away, even though sometimes you can't. But I'm feeling jealous right now. But they actually have quite a few of these spots that can be activated and they know it. All right. So those of you that don't know it, you know that you don't have it too. So we need to find out how we can stimulate those. Again, I call them sexual spots, hot spots, so that you can get that orgasm like everyone else. Okay. All right. The A spot. That's a huge spot for women. All right. It's located anteriorly on the same side, upwards, same side as the G spot. So you see the G spot here, the A spot there, and you actually can reach it when you get to the anterior fornix up here, come down about two centimeters, an inch, come down an inch, and that's where it's located. Again, hard to get to if you're very long, right? But again, depending on the position that you're using during sexual activity, you can reach it, or with a toy, right? You can get up there and reach the top of your vagina, right, which is the anterior wall. Again, it's not the same as the G spot because the G spot actually changes. This is just an area behind the bladder. This is the bladder here. This is the uterus here that actually gives you a nice stimulation sexually, okay? Back behind the anterior fornix is the posterior fornix, and we have the O spot, okay? The O spot is what he says is right here, this big red bulb there. And the O spot is really close to the rectum. So you see the rectum here? So you can actually have penetration from the anal area and get aroused that way, or from the vagina and get aroused that way. Either way, this is another big spot. And you can see the sizes. He puts them different sizes to tell you how big the stimulation can be, okay? So this is a big one, this O spot right here, okay? Then we have the cervix. Now, I've got patients and people that always say their cervix has to be hit. That's an individual thing. Some people don't like it. Again, you decide whether you want it to be hit or not. But for some people, it is a hot spot, okay? Right there's the cervix. That is the neck of the uterus. So this is the uterus, and that neck where the baby's head comes through when we're having babies, that is what is termed the cervix. And again, it is, some people have a lot of nerve endings there, and they actually get a lot of stimulation when they go there, but some people don't. It is an individual basis. And I think that if you have fibroids in here, it can be uncomfortable. So just watch out. It's not a must. Just know that is another hotspot or deep vaginal erogenous zone, DVZ, okay? Now, if you come down here, we see this muscle, this brown strip. This is called the pubococcygeal muscle, or PC muscle. That's what he calls it here. And he says that it is a hot spot. Now, not sure how it's a hot spot because it's a long muscle, so you can't really call it a spot. But he does point to it as being, and puts a star again against there, saying that it is a very important muscle, meaning, I guess if you are one of those people that have a hot spot in the muscle, it will be activated and you're going to have a great orgasm. But I'll tell you, whenever I hear and talk about the PC muscle, let's call it just the PC muscle, we talk about Kegel exercises. So the Kegel exercises have got to be done, especially during sex, okay? I know we're supposed to do it during the day. Some people do it all day, all night. Unfortunately, I do not. but you need to be able to get that muscle tight, and it's good exercise because there's no really other good exercise for that muscle except the Kegel exercises. And remember, the Kegel exercises is where you take a deep breath, hold, squeeze tight all the muscles down in the pelvic area, because we need this muscle to support all these organs. If this muscle falls, then you're not going to have any good spots because they're going to be weak and out of place. So you want to have this muscle strong. So come on, guys, let's do a Kegel exercise right now. Take a deep breath, hold tight, tight, tight. You don't want to use the bathroom, just hold tight for a few seconds and relax. That's your Kegel exercise. And guys, you benefit too. I'm going to talk about your deep zones too, okay? Not vaginal, deep male erogenous zones that y'all have. I can't wait to talk about that, so stay tuned for that. But again, the Kegel exercises both for men and for women. So you have got to do the exercise, guys, whether you like it or not, to get the support of the pelvic floor when you are performing sex. All that you need strength and strong to be able to get into a woman. And if you don't have strength there, you're not going to be able to penetrate. So very important to get that muscle strong. Okay. So that is generally what he considers to be the G-spot. But there are more G-spots, okay? Another G-spot, well, when I say G-spot, another hot spot that we talk about is the, all right, we have the K-spot. The K-spot is the perineum in between the anus, see the anus here, and the vagina. So it's that thin skin between the two. Now, I'm sure you all already know about that. That's a very nice, sensitive area there. The anus, okay, I forgot to say the anus is also a hot spot or a deep vaginal erogenous zone that people do like, so don't forget that. So the most important thing is that he does include it, which is good, but he does not include the K-spot, which stands for Kundalini. Okay, that's just some of the terminology they use. And these spots are controversial. I'm sure you know, not everyone agrees with these hot spots. I do significantly agree because it is so proven that women that can actually have these spots enjoy sex more than those that don't, okay? And if you don't, I'll say it again, see a doctor like me. This can be improved. There are certain techniques and certain hormones you got to check, and that can be improved, okay? All right, another, I'm just going to cheat a little bit. Let's see. The P-spot is one that is located opposite the G-spot. He doesn't have a diagram here. That's the P-spot right there. You go in and it's about the same inches, about 2 inches above the opening of the vaginal opening. And I want you to know that some people do have that spot there and get stimulated and again are able to enjoy sex and have that orgasm. Okay. And let's see. I'm going to make sure that I got all of them. So the clitoris we talked about, the G-spot, the A-spot we talked about, the O-spot we talked about, the PC muscles we talked about, the cervix we talked about. Then we have the U-spot that we talked about, the P-spot we just talked about, the K-spot, the V-spot we spoke about. The last spot is the E-spot. Now the E-spot is not a spot on the body. It really is just an energy, just a feeling of being sexual and being hot. I think that's my word of saying feminine essence. The feminine essence. A lot of us tend not to have time to remember that we're women, right? We are working hard. We're doing men's work because we have to, right? So it's important for us to have that knowledge that the E-spot, which again is unofficial. I saw it in a magazine. I'm not even sure if it really exists in the medical world. I haven't seen it in my articles. But I just want to mention it that, you know, it is true that we do have to have some love for ourselves and be able to know that you are a woman. We're not men. Remember that. Don't want to be, right? It's too hard to be a guy. So we want to remember that we are different, and you can see even here how different we are. And when we talk about it with the men, we're going to see some difference too. But again, it's not just these zones that will be involved. We know that. We have these nerves, right? The pudendal nerve is very important in terms of supplying the clitoris. If you have any injury, even sugar issues, if you have diabetes, you're affecting the nerves of the hot spots. So the nerves are not going to get as stimulated easily. It's going to be harder to stimulate them. So you're going to want to have your sugar under control. Same thing with blood pressure. Blood pressure, we need blood flow. So you want your blood pressure under control for these areas to get circulation, to get blood flow and function and work well, okay? So why do I talk about this? It's because it's health. If you do your exercises, the Kegel exercises, you keep it, your areas, of course, taught in terms of healthy, eating well, exercising, and getting those hormones checked, you're going to have a great internal structure, even if you have kids, right? And you're going to be able to maintain these hot spots and be able to enjoy sex with your partner. And remember, orgasms are really the ultimate goal. Yeah, you want to enjoy the play and the relationship in terms of even cuddling, but the ultimate goal is to have an orgasm and to know that you can have the best orgasm in the world. So don't forget, these spots you've got to learn about and know where yours are and whether you like yours touched. Again, deep touch, right? We are not talking about how to get them stimulated right now, but you want to get them pressured so that you can get an awakening, just like any other sexual activity, and enjoy yourself with your partner. Safe sex with consent. All right, guys? A nice talk. I hope you learned something. I will see you next time. Take care. Ciao. Bye.